Yay! And put one stitch on each side on the bottom too. It'll dissolve on its own in a couple days, so nothing we have to take out later. Tops didn't need any stitches there. Then I took the graft from the left side of the roof of her mouth and then just grafted it right around just where she had that gum recession there.
Right.
Put some stitches, probably about 6 or 7 stitches in that. Those stitches, they usually stay in there for a couple weeks here, so we'll just leave that in there for a couple weeks.
And those won't dissolve?
Well, yeah, they do dissolve over the course of a couple weeks here. Okay. The most important thing with this graft is it takes about 2 to 3 weeks for the blood vessels to kind of grow into that graft and for it to really start taking there. And so I really don't want anything to push it or disturb that graft. So that's why I told her I want her basically on almost a liquid diet here for the next couple of weeks because I just don't want her to bite into something. So I don't want her to bite into something and
right, mess it up.
And as far as brushing her teeth, she can brush all her top teeth normal. On the bottom she can brush from about the canines back, but I don't want a toothbrush around just in the front here, so I just don't want it to hit it there. Gave her a prescription for some Lorset for pain medicine. She takes one of those every 4 to 6 hours as she needs it for the pain. Also gave her a mouth rinse. It just kind of numbs it up in there because the roof of her mouth will be really raw here for about 2 weeks here where we took the graft, and it'll numb that area up there, and then also gave you an antibacterial mouth rinse that'll just help keep everything clean since she's not brushing right here now.
But that can get on that area? The
mouth rinse?
Yes.
Oh, yeah.
Okay.
Yeah. I just don't want anything physically hitting it, causing it to move or rub or anything, because they can just disturb the blood vessels growing into it, and that can cause it to not take.
Okay.
So, all right, y'all have any questions about anything? No?
No.
All right. So, all right, well, Rhonda here, she'll be back here in just a minute, and she'll help y'all get her to the car, and y'all give me a call if any questions pop up, okay? Okay. We'll see y'all.
Thank you.
I made a follow-up for her in a week.